In this video, we discuss the use of low-dose naltrexone, LDN, during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Naltrexone was approved by the FDA in 1984 for alcohol and opioid use disorder. Low-dose naltrexone refers to doses up to approximately 4.5 milligrams a day, about 1/10 the size of a dose typically used for alcohol and opioid use disorder. The low dose of naltrexone briefly blocks endogenous opioid production, creating a temporary opioid deficit. In response to the opioid deficit, the hypothalamus increases endorphin production. The endorphins then bind to cancer cells, triggering apoptosis and stimulating natural killer cells and helper T cells. Additionally, low-dose naltrexone has also been shown to inhibit toll-like receptor 4, which is responsible for pro-inflammatory immune responses. LDN has also been found to inhibit the critical mTOR pathway. Through its anti-inflammatory action, LDN has shown impressive results in a variety of diseases. A double-blind, placebo-controlled trial showed LDN produced a significant improvement in symptoms of multiple sclerosis. It also produced a significant improvement of symptoms of HIV in a placebo-controlled trial. LDN led to a 2-fold decrease in symptoms of Crohn's disease and a 3-fold decrease of physical presence of the disease as evidenced by an endoscopy. LDN shows particularly promising results for people with primary cancer of the bladder, breast, liver, lung, lymph nodes, colon, skin, and rectum. LDN synergizes with most standard of care cancer medications and helps block the negative side effects of interferon alpha therapy. A placebo-controlled trial found LDN to reduce side effects from cancer treatment in blood-based cancers. An additional meta-analysis involving nearly 5,000 patients with multiple indications revealed that LDN did not produce side effects greater than placebo. There are numerous case reports in the academic literature regarding the efficacy of low-dose naltrexone in cancer treatment, although standardized clinical trials are lacking. One case report described a stage IV colon cancer patient who was told that conventional treatments held no more hope for him, and that any further treatment would at best be palliative. At an integrative cancer clinic, he was put on a protocol of LDN, IV vitamin C, IV alpha-lipoic acid, hydroxycitrate, milk thistle, and a healthy lifestyle program. The symptoms of his cancer resolved. 9 years later, he was healthy and working full-time. Other case reports include complete remissions from pancreatic cancer, B-cell lymphoma, tongue cancer, esophageal cancer, uterine cancer, prostate cancer, and adenocarcinoma of unidentified primary origin. The real wealth of data regarding the efficacy of low-dose naltrexone is anecdotal data, self-reports and physician reports about people that have responded when low-dose naltrexone was added into their regimen when they were refractory to other treatments number in the hundreds. As described in the LDN book, Dr. Bernard Bihari reportedly treated 354 refractory patients with LDN, obtaining a response rate of 20% and disease stabilization rate of 25%. Dr. Bihari had been working with HIV patients in the 80s and noticed their endorphin levels were approximately 20% that of the uninfected population. His observations led him to test LDN's usefulness in other diseases, including cancer. Dr. Bihari's reports were reviewed by an oncologist from the National Cancer Institute, NCI, and verified to be true. Another pioneer for the use of LDN in cancer is Dr. Bert Berkson out of Arizona. Dr. Berkson's protocol is primarily based around a combination of intravenous alpha-lipoic acid, intravenous vitamin C, and low-dose naltrexone. He has treated hundreds of patients and has reported his encouraging findings in numerous case studies. Low-dose naltrexone is also a very promising option for long-term pain relief with no harmful side effects, but it should not be taken along with opioids due to negative interactions. What is the LDN protocol developed by Dr. Bert Berkson? As described in one of his case studies, it is asterisk, a high dose of intravenous vitamin C in the morning. In the case report, the patient weighed 176 pounds and received between 25 grams and 50 grams of vitamin C in his IV daily for a week. Asterisk, 300 to 600 milligrams of racemic alpha-lipoic acid via IV in the afternoon. It is spaced from the IV vitamin C to prevent hypoglycemia. Asterisk oral LDN, 4.5 milligrams at bedtime. Asterisk oral racemic alpha-lipoic acid, 300 milligrams twice daily. Asterisk oral selnamethionine, a form of selenium, 200 nanograms twice daily. Asterisk oral silimarin from milk thistle extract, 900 milligrams twice a day, along with 3 professional-strength B50 complex capsules a day. Asterisk oral hydroxycitrate, HCA, found largely in Garcinia cambogia extract, 500 milligrams, 3 times daily. In the case study, the patient received IV vitamin C and IV alpha-lipoic acid every day at Dr. Berkson's clinic for a week, then returned to his home in another state and received the IV treatment only 2 times a week while continuing with the oral component daily. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.